What is depression? Feeling sad, or what we may call depressed, happens to all of us. The sensation usually passes after a little while. People with depressive disorder or clinical depression find that their state interferes with daily life. For people with clinical depression, their normal functioning is undermined to such an extent that both and those who care about them are affected by it. Melancholia, clinical depression, is a fairly modern term. Hippocrates, known as the father of Western medicine, described this syndrome of melancholia. He said melancholia was a distinct disease with specific physical and mental symptoms. Hippocrates characterized it as all fears and depressions, if they last a long time, as being symptomatic of the illness. Eugene S. Packel wrote in the journal Dialogues of Clinical Neurosciences that the term depression started to appear in the 19th century. According to the National Institutes of Health, a significant percentage of people with depressive illness never seek medical help. This is unfortunate, because the vast majority, even those with severe symptoms, improve with treatment. Nobody is exactly sure how many people are affected by depression. Health authorities from country to country, and even within the same nation, publish different figures. The National Institute of Mental Health estimates that 6.7% of American adults have had depressive illness during the last 12 months, and 30.4% of those cases, 2% of the whole adult population, have severe symptoms. While the National Institute of Mental Health says women are 70% more likely to develop depressive symptoms during their lifetime. An article published in JAMA Psychiatry, August 2013 issue, showed that depression affects 30.6% of men and 33.3% of women. Not a statistically significant difference. There's many forms to depression, one of them being major depressive depression. Major depressive disorder is also known as major depression. The patients suffer from a combination of symptoms that undermine their ability to sleep, study, work, eat, and enjoy activities that they used to find pleasurable. Experts say that the major depressive disorder can be very disabling, preventing the patient from functioning normally. Some people experience only one episode, while others have reoccurrences. Another form of depression is dystemic disorder, dysthymia. Dystemic disorder is also known as dysthymia, or a mild chronic depression. The patient will suffer for a long time, perhaps as long as a couple of years, and often longer. The symptoms are not as severe as in major depression. They do not disable the patient. However, people are affected with dystemic disorder may find it hard to function normally and feel well. Some people experience only one episode during their lifetime, while others may have reoccurrences. A person with dysthymia might also experience major depression once, twice, or more often during their lifetime. Dysthymia can sometimes come with other symptoms. When they do, it is possible that other forms of depression are diagnosed. For a patient to be diagnosed with dysthymia, he or she must have experienced a combination of depressive symptoms for at least 2 years. The next form of depression is psychotic depression, when severe depressive illnesses include hallucinations, delusions, and or withdrawing from reality. The patient may be diagnosed with psychotic depression. Psychotic depression is also referred to as delusional depression. Postpartum depression or postnatal depression. Postpartum depression is also known as postnatal depression or PND. This is not to be confused with baby blues, which a mother may feel for a very short time after giving birth. A mother develops a major depressive episode within a few weeks of giving birth. It is most likely that she has developed postpartum depression. Experts believe that about 10% to 15% of women experience this type of depression after giving birth. Sadly, many of them go undiagnosed and suffer for long periods without treatment and support. Postpartum depression can start any time within a year of giving birth, according to the National Library of Medicine. Another form of depression is seasonal affective disorder, also known as SAD. SAD is much more common the further from the equator you go, where the end of summer means the beginning of less sunlight and more dark hours. A person who develops a depressive illness during the winter months might have SAD. SAD symptoms go away during spring and or summer. In Scandinavia, where winters can be very dark for many months, patients commonly undergo light therapy. They sit in front of a special light. Light therapy works for about half of all SAD patients. In addition to light therapy, some people may need antidepressants, psychotherapy, or both. Light therapy is becoming more popular in the northern countries, such as Canada and the United Kingdom. The National Health Service, UK, suggests that sunlight may stimulate the hypothalamus, a part of the brain that controls sleep, appetite, and mood. Another one is bipolar disorder, manic depressive illness. Bipolar disorder is also known as manic depressive disorder. It used to be known as manic depression. It is not as common as major depression or dysthymia. A patient with bipolar disorder experiences moments of extreme highs and extreme lows. These extremes are known as manias. There are the signs and symptoms of depression. Depression is not uniform. Signs and symptoms may be experienced by some sufferers and not by others. How severe the symptoms are and how long they last depends on the individual person and illness. Below is a list of the most common symptoms. A constant feeling of sadness, anxiety, or emptiness. A general feeling of pessimism sets in. The glass is always half empty. The person feels hopeless. Individuals can feel restless. The sufferer may experience irritability. Patients may lose interest in activities or hobbies they once enjoyed. He or she may lose interest in sexual intercourse. Levels of energy feel lower. Fatigue sets in. Many people with depressive illness find it hard to concentrate, remember details, and make decisions. Sleep patterns are disturbed. The person may sleep too little or too much. Eating habits may change. He or she either eat too much or have no appetite. Suicidal thoughts may occur. Some may act on those thoughts. The sufferer may complain more of aches, pains, headaches, cramps, or digestive problems. These problems do not get better with treatment. Nobody is sure what causes depression. Experts say depression is caused by a combination of factors, such as the person's genes, the biochemical environment, personal experience, and psychological factors. A study published in Archives of Psychiatry found that MRI, magnetic resonance imaging, scans showed patients with clinical depression had less brain volume in several regions, including the frontal lobe, basal ganglia, and hippocampus. They also found that after the treatment, the hippocampus returned to normal size. The Stanford School of Medicine says that genes do play a role in causing depression by studying cases of major depression among identical twins whose genes are 100% identical and non-identical twins whose genes are 50% identical. They found that heritability is a major contributory factor in the risk of developing depression. An article in Harvard Health Publications explains that depression is not caused simply by the level of one chemical being too low or another too high. Rather, several different chemicals are involved, working both within and outside the nerve cells. There are millions, even billions, of chemical reactions that make up the dynamic system that is responsible for your mood, perceptions, and how you experience life. An awful experience can trigger a depressive illness. For example, the loss of a family member, a difficult relationship, or physical and sexual abuse. The treatments for depression is usually antidepressants. The aim of an antidepressant is to stabilize and normalize the neurotransmitters in our brain, naturally occurring brain chemicals such as serotonin, dopamine, and norepinephrine. According to various studies, these neurotransmitters play a vital role in regulating mood. We know they regulate mood, but we are not exactly sure how they do it. SSRIs, selective serotonin reuptake inhibitors, are the newest antidepressants. They are also the most popular. Prozac, Celexa, and Zoloft are all SSRIs. SNRIs, norepinephrine reuptake inhibitors, are similar to SSRIs. Effexor and Cymbalta are SNRIs. SSRIs and SNRIs are more popular today than older types of antidepressants, mainly because they have fewer side effects. MAOIs, monoamine oxidase inhibitors, and Triclix are examples of older antidepressants. Nevertheless, modern antidepressants do affect some people with undesirable side effects. For people who experience high levels of unpleasant side effects with SSRIs or SNRIs, Triclix or MAOIs may be a better option. If you're taking MAOIs, you have to be careful with your diet and other medications. MAOIs have potentially serious interactions with some foods and drugs. Cheeses, wines, and pickles have high levels of tyramine, which interact with MAOIs. They must be avoided. Some decongestants also have tyramine in them. When MAOI interacts with tyramine, the patient may experience a significant rise in blood pressure, which in turn increases the risk of stroke. If a doctor prescribes an MAOI, make sure you receive a comprehensive list of foods, medicines, and substances you should avoid. If an antidepressant does not work, if you find one drug does not improve symptoms after a few weeks, tell your doctor and see if he or she can get you onto another one. Research has shown that treatment is much more successful if a patient switches from a drug that does not seem to be working to another one. That is my informative speech on depression.